Sorry. There you go. I am currently the internal president for the Central Cal region of Emt. So I work a lot with these lovely young ladies. So a little background about me is that I graduated from Fresno State and I double majored in biology and chemistry. Originally chemistry was my original major, but I decided to add on biology. So usually it's just an extra year. I am currently in the application process right now for the cycle 2021 to 2022. So let's see how that goes. Hopefully it goes well. And then I do hope to specialize in the future in pediatrics. I know pediatrics for sure is the field I want to go to, but what specialty specifically right now, I do not know. So as for my position, I did work as an emergency support technician at Valley Children's Healthcare here in Madera, California. I specifically work in the emergency department. I worked there for over 2 years and I was the graveyard shift. So pretty much I will go in from 10:30 at night and I will come out at 7 in the morning. So it's a little rough schedule, but you kind of get used to it. I do have to say that it does mess with your sleeping schedule for the following years. I recently no longer work at Valley Children's because I took up another research position and I still can go to sleep until 4 in the morning. It's just something I'm kind of used to now. So that's just something to keep in mind as you guys look into clinical experiences. So for this position, for a lot of the hospitals that you apply to, the majority of hospitals, they have technicians both in the ED and on the floor, and they each do different jobs depending on what kind of patients you work with. But usually the requirements are to have an EMT license or a medical assistance license, or to be a current nursing student. So you will find a lot of nursing students are working as techs in hospitals in order to really gain experience working with patients and other nurses and just kind of get the feel what the hospital is like. Because usually the nursing students, once they work as a tech, once they graduate from the nursing program, they tend to get hired right away by that same department. So that's one benefit nursing students have. So if you're pursuing a career in nursing, that's something to keep in mind. So whether they require EMT or MA license, it really does depend. From my specific hospital, Valley Children's, when you work in the emergency department, they do prefer an EMT license over an MA license because we work with a lot of emergencies. The job is very hands-on. You're with the patient a lot of the times by yourself. So if something emergent comes up, they hope that you have the training to handle it until you're able to get help one way or another. An example of this is that one of my responsibilities was transporting patients around the hospital. And then one time I did transport a patient that started seizing on the elevator on the way down to the bottom floor, and then their oxygen started dropping. So in that moment, my EMT kind of training kind of kicked in, whether like how to put the bag bubble mask over their face, start giving them oxygen and kind of rush them to the room. And once in the room at the same time, kind of like yell at the nurses in the hallway to come help and just like throw on like a simple mask on them to give them oxygen. So that's training you get in EMT school that you don't get as a medical assistant most of the time. So in our hospital, we're called emergency support technicians just for the emergency department. And then the rest of the floors, they have their different techs. So for on the floor, for example, if you work on rehab, or if you work with oncology patients or the respiratory kits, you're called a patient care tech. And right there, a lot of the stuff you do is just simply like take vitals, take care of the patients. Since it's a pediatric hospital, a lot of the patients are young and their parents are not usually there. They can't be there 24/7. So you do bathe them a lot and just kind of take care of them, play with them, stuff like that. And then the techs for the ICUs, we have a NICU and PICU. They're called, I think, the intensive care techs. So their role responsibilities is completely different. They're used to being in a lot of codes and stuff like that. So they have special training for that. So that's just something to keep in mind. For the emergency department and the PICU and NICU techs, they do prefer EMT licenses. But I've noticed for on the floor for the PCT, the regular patient care techs, they do like the medical assistance license because they do a lot of the stuff that medical assistants tend to do in other facilities. So the application process for this job is like any other job. You apply when there is a position open, you go to the hospital's directory. If they do have a tech position open, just apply. It is kind of competitive to get into some hospitals because there's many individuals where being a tech is their full-time job. That's their career as it is. So usually like knowing someone in the hospital to get in does help, or having experience working as an actual EMT or some medical assistant, like in a nursing, like some other facility, like an elderly facility, it does help you get jobs in these hospitals. And the pay does vary depending where you work. Like for example, if you're a tech at, I think Kaiser, you get paid like $30 an hour, which is pretty good. So that's why a lot of individuals, like, this is their career, this is their full-time job. One thing to keep in mind is that it's a very high stress environment, especially for me working in the emergency department. Here in Valley Children's in the Central Valley, we're a very rural area, so we're the only pediatric hospital here in the Central Valley. So you do get a lot of critical patients. So it's high stress environment. You kind of learn how to handle that kind of stress, not only working with patients, but when working with pediatrics, you also learn how to work alongside with the parents. As many of us learn, like, for the parents, what's the most important thing in their life? Their child. So you need to learn how to be there, not only for the patient, for the parents. It's a lot of hands-on patient care, as you will see once I go into my responsibilities. You do work independently most of the time. And this job, you work like as a side aid a lot for the nurses and the physicians. So they kind of delegate tasks to you, and there's a lot of stuff you do independently, and they have to be able to trust you that you're going to do this job well and report to them any changes that occur on the patient. Because as we know, many times the doctors are seeing like 20 plus patients. And right here in California, most nurses are assigned 4 patients at a time. So they do rely on you a lot to help them take care of the patient. And of course, this job is big among nursing students and pre-nursing students, if you guys are interested in that, because you do work extremely close with the nurses. So these are just some of my responsibilities that I had as a tech in the emergency department. So the first one, of course, was vital collection, collecting vitals for the patient. This is something that we're relied on often by the nurses, because the nurses do have many times many other tasks to complete, especially since they have more than one patient. The cool thing when working with pediatrics, you kind of get to memorize what are like the baseline vital signs for many patients. For example, for like a child, let's say that's 6 months old, you're going to know that the regular blood pressure for that child is usually like 80 over 40. Regular respirations are going to be in the high 40s, low 50s and stuff like that. And it's a completely different story for a teenager. So you need to know what the vitals are and just kind of like memorize that. So if there's something that's not in line, you have to notify the nurse or the physician. So from there on, they could take action, whatever step is next. Another one of my responsibilities that I did phlebotomy and a lot of the specimen handling and collection. Many hospitals, including ours, we have kind of like a phlebotomy specialist, but they're only there during the day. So at nighttime for graveyard shift, we don't have any phlebotomists. And then even though the nurses are skilled at doing IVs, it's completely different doing a straight stick, and a lot of them are not able to do it if they don't have any experience. So a lot of the ED techs and NICU and ICU techs took a phlebotomy course paid through the hospital, and we got a phlebotomy technician license. So we were able to do that, handle the specimens. It's very different working with pediatrics because, as we know, for children, the youngest child I've drawn blood from, I think, was 3 days old. So you need to know how to do that carefully. Of course, they're babies. The veins are extremely small and delicate, so you don't want to pull the vein and lose it and have to poke the patient again. Because let me tell you, parents do not like you poking their child many times. So if you're going to poke them, you better poke them only once. So that's one thing I've learned. And also just collecting specimens. So you do help collect feces, you help collect urine, you help collect fluids from the lumbar puncture, stuff like that. Another one of my responsibilities was patient transport. So I was the one that transported patients from the ED to their room and the inpatient in the hospital. So I transported them around the hospital. And also whenever we had a trauma coming in, it was my responsibility to go out to the helipad and bring in the patient into the trauma room. So that's one thing I was in charge of. I often also prepared patient and room for procedures and assisted with procedures as appropriate. So as a tech, you work alongside a lot with the nurses, the PAs, and the doctors and the residents, helping them with the patients. Specifically for my job, we work with kids, and whether it's an IV, whether it's collecting urine or anything, kids will fight you. So we learn how to properly hold a child and keep them still in order for them to be able to do the procedure in a safe manner. And many of these things is like learning how to kind of like wrap the kid in a burrito, kind of hold them down firmly. So that's one thing that's very important. So I often held down the kids for the nurses when they were doing IVs. I held down the kids, well, usually the babies also when the doctor was doing an LP, and just a lot of stuff like that. many times when kids came in and they needed a sedation to kind of put a bone back in place, you could say, when they will sedate them, even though they're sedated, they do tend to move a lot. So you kind of hold them down while the doctor kind of like pops the bone back in. So you use this with a lot of procedures like that, and they do depend on you a lot to set up for them and kind of help them along the way. Because the nurses, many times, for example, in my hospital, they never took a phlebotomy course. So once they see the labs that come out, many of them did not know which lab belonged in what specific vial. Another thing when handling with pediatric patients, you have a blood minimum that you could take out within like a 24-hour span. So like say for an adult like myself, I think the maximum blood that we could take out in 24 hours is 20 milliliters, which versus a baby, a newborn baby, it's only 3 mL. So they have a large collection of blood work. You need to know exactly where it's going and what are the minimums, because you do not have a lot of space to kind of work around with. And that's something that they depended on the text on a lot. Another thing I did is I managed stock supply. So this is filling up the IV trays and taking them out to the different departments, making sure everything is stocked. So whenever we need an IV stat, we're ready to go. I applied splints in orthopedic soft goods, and I fitted patients for crutches. So I did a lot of the splints. And then let's say a patient came in with a wet cast. I was the one with like kind of like the saw removing the cast. I also perform EKGs on patients, just the same thing as phlebotomy. Our EKG hospital techs, like overall, like the actual techs for that, they're only there during the day. So in the ED, I think we were the only ones that got the EKG technician license in order to do EKGs, not only in the ED department, but the rest of the hospital when they needed that. So we do the 12 lead EKGs. I also perform glucose measurements. That's something very important to do. I was on the trauma team, so I was a trauma EST. So a lot of this was really like, once the patient gets in there, you take the vital signs, you connect them to the leads, you have to do a manual blood pressure whenever there's a trauma. Manual blood pressure is more accurate than an automatic blood pressure, so that's very important to get in. The doctor's late, like pretty much just yelling at you in the moment what labs they want. So this is when your training in phlebotomy comes in, and you have to know exactly what labs to get, what minimums you need, because a lot of the times, for specifically my hospital, we're working with pediatric patients. We do the compressions, we prep the IV fluids for the nurses that are doing IV. We help hold on the patient many of the times during the trauma when the nurses are trying to put in the IV or when the doctor is trying to put the IO, stuff like that. You have to learn how to work fast, even though there's a lot of people yelling at you, telling you to do different things, and just learn how to prioritize in the moment. And all of this comes with experience. I also did prep expired patients. So expired patients is the medical term for patients that did pass away. They're in the hospital, usually after a trauma. That's usually the word we use because we do a lot of note taking also as techs, as nurses, as PAs, as RTs. Everything you do in the hospital, you got to make sure to document it. But of course, that's a word that you never want to use with the patient's family. But I did help prep them. Many of the times whenever a patient passed away, we gave the family time, and the family, of course, will come see the patient, just give them time, a few hours with them. So by the time the family like leaves, rigor mortis does tend to like set in. So we have to learn how to properly like put down the limbs to make sure the patient's not moving around when we're transporting them to the morgue. Another task I did do was one-on-one observations. We call them 5150s. Is when you could do this in any ED where if you or someone you know is having suicidal thoughts or attempted suicide, you take them to the ED and we put them on a hold where me, a tech, will watch them just 24/7, keep our eyes on them and make sure they're safe. So those are just some of the responsibilities from my job. And of course, as I mentioned previously, some of the certifications that I did obtain through the hospital is I got my phlebotomy technician license. I was an EKG technician, and of course my heart code BLS since I was on a trauma team.
Thank you, Mirka. So if we have any questions for Mirka regarding her position, you guys can direct them in the chat. If you would like to unmute yourselves at this point, you can do that as well.
We have one question from Vinita, who is just asking Mirka if you had any experience working as an EMT or a volunteer EMT before you applied to this position.
I specifically did not. Like I said, knowing people in the hospital does help. At the time when I was applying, my cousin, he was a nursing student and he was a tech at the hospital. So having someone put in a good word for you does help if you don't have any experience. One thing I forgot to say is that I got my EMT certification through Fresno State. EMT and the medical assistant courses are very, very expensive. So if you're able to find summer courses that are kind of like half the price, that does help. But for me, my EMT course was part of my tuition at Fresno State. But for previous experience, I didn't have any. Knowing someone does help. And if you don't know anyone that works in a hospital, try to get at least 1 year of experience as an EMT or an MA at a senior facility. And that does help you get in. So that's what I saw with a lot of my coworkers that were able to get the job.
Sohan has his hand up. Go ahead.
Yeah, so thanks, Mirka. I have a quick question about the EMT. Do you know how long it takes? And do you know, like, is it possible to do an EMT course while in school, or does it have to be like while you're out of school?
But most EMT courses, I don't think they're that long.
I want to talk a little bit about it.
Yeah, Noel's going to talk a little bit about it because he did take an EMT course. But for example, my course at Fresno State, it was just 1 semester and it's not a lot of work. We didn't really get that much homework, but like during the class, you were learning how to do compressions, how to do vitals and just stuff like that, how to safely transport patients. You do lift a lot. One thing I need to tell you guys when working in a hospital, protect your back at all times. You do not want to hurt yourself. So whenever you can lift up a gurney or use some kind of device to help you, definitely do it. Because I saw so many individuals hurt their back, and it's pretty much permanent back damage. So be very careful with that. But Noel will talk a little bit more about the EMT license outside of school. But at Fresno State, it was a super easy class.
We have another question in the chat here. They're asking what the minimum pay is for this job position and whether it increases as you have more experience over time.
Okay, yeah, so my hospital, I'm not gonna lie, Valley Children's does tend to pay a little less than other hospitals, but people do work there because they truly love working with patients, like pediatric patients. A lot of people, they cannot do adults, so they work there. For example, my pay did increase every year, so you increase by a little bit. But I think my baseline pay, I wanna say it was barely a little bit over minimum wage, but I got paid extra because I work graveyard shifts, so I got the overnight differential. So I got paid like $3 more, especially since I worked from 10:30 p.m. to like 7 a.m. So it does depend, but other hospitals, if you're able to get in, like for example, let's say you become a tech at Kaiser, it's more competitive to go there. And usually the techs they do accept are the techs that have been techs for a while. And I know their pay is like $30 an hour, so that's pretty good. So a lot of techs from Valley Children's, once they got their experience, they applied to Kaiser and they transferred over and they pretty much they're paid doubled.
Thank you. I don't have any more questions in the chat on my end. And Ailey, did you have any more for me to go?
No, not right now.
Okay, we can move on to the next position then. So our next speaker was going to be Yesenia Ramirez. However, she had a time conflict, so I will be presenting for her position for her. So Yesenia works as a patient care assistant. Some of her background is that she graduated from Fresno State in 2020. She majored in kinesiology and with a minor in deaf studies. She's a pre-med student in her hustle years. She's completing an informal post-bac program. And her position with me Menthod is that she's the VP of Outreach for the Central California region. So for her patient care assistant position, she worked at Care Meridian as a CNA for a year, which is a facility for individuals with spinal cord injuries. So some of her roles included taking vital signs, giving the patient showers, feeding them, providing them with medications, and she worked up to 12-hour shifts there. And recently she's been at Fresno Yosemite Healthcare for the past 2 years. So it's an in-home care, which means that you're visiting each client in their homes and providing care there. So it includes some of the same roles, such as taking vital signs, reminding them to take their medications based on the time and date that the doctor has prescribed them for, assisting with and documenting activities of daily living, and along with communicating with other nurses about their health and progress that they are making there. So how to become a CNA or a PCA. So the training program that she did was with the Clovis Nursing Assistant program. So this specific program, it's offered twice a year in February and September. The class fees for this program were $1,000. There's also additional costs ranging between $500 and $700 for things such as books, uniforms, health requirements, immunizations, along with the state fee exam for the CNA certification. And I will be leaving you all with her email if you guys have any further questions for her specific position. But I just wanted to share a little bit about her position. I myself have not worked these positions, so I personally don't know much about them. But if you do have questions, I'll leave you with Yesenia's email and you guys can reach her that way. So this is another program that she shared. It's the Valley ROP. It's for the patient care assistant position. So the cost for this program is $850, and it includes textbook, skills, workbook, uniform and fingerprinting costs. And they have 3 different locations throughout the valley, including in Reedley, Sanger, and Selma. Once you obtain your certification, you can work in various locations, including home care, hospitals, clinics, skilled nursing facilities, along with acute care. And as I mentioned before, she's very open to answering any questions that you may have. So I will leave you all with her email at the end, and you guys can reach her that way.
You guys can reach out to Yesenia. And I also did a CNA class. Mine, I never worked as a CNA, but I did a class because I thought having the certification would be good. And mine was like a 30-day program at Fresno called Nursing Assistant Training Academy. So you guys can also ask about that. Yeah, besides that, I know a lot of people that were filling out the survey in the beginning were asking about how can we get healthcare experience that doesn't cost a ton, because a lot of these programs cost a lot. I also have seen some CNA training programs that are offered for free. I believe most of the ones I've seen are through Golden Living, but the hours are kind of bad. It's like you have to be available like 7 to 3 p.m. weekdays. But if you reach out to me, I can also try to get you guys that information, and also to Yesenia, because she seems to know a lot about different programs and more about what the actual job would entail.
Yes, building on to that, I do have a friend that did one of a free program with Pacific Gardens, which is in the Sunnyside region in Southeast Fresno, if any of you are familiar with that. So they allow you to complete the program for free. However, right after you obtain your certification, they have a job position waiting for you. So once you obtain your certification, you can start working with them directly to like build your experience, and then move to any other, like if you want to work at like bigger hospitals or facilities, you can complete your training there and then move on to other places if you would like. So we'll move on to our next speaker, which is Noel Cruz. He will be sharing about his position as a COVID vaccinator, and he's also been a director of outreach with the UCSF Mobile Field Clinic in the past. So he'll be sharing about that with us.
Hello, everyone. I'm Noel. There you go. I'll put my volume up. Okay, so I'll start with, just 2 things I'll be talking about, like she mentioned. I'll start with the background, and I'm also gonna throw in just like a little extra in there, just because why not? You know, the more you guys information you get, the better. It's gonna be very similar to what Mirka said, because I did work at the hospital with her too, but not as a tech. So I grew up, I'm originally from the Bay Area. I lived most of my childhood there. And then so I ended up going to Berkeley City College, then transferred to Fresno State, where I graduated, got a BS in biology and then a minor in chemistry. And I am a current medical school applicant for this cycle. And just threw in there what I want to be, you know, in the future, pediatric. I want to get into pediatric emergency medicine. Originally, I just wanted to do emergency medicine, but after working at Valley Children's, kind of really, I guess you can say, fell in love with pediatrics. So that's where I want to end up. So, but before I start talking about the director of outreach role at Valley Children's, I know it's kind of like depending on who reads your application and what they can consider clinical experience, but in some people, they consider it. So I did registration, the ED at Valley Children's in there. So I did a lot of, like typical, like registering the patients or what's it called, checking them in. So whether they're just walk-ups or taking EMS, right, like ambulance or the helicopter drop-offs. They would drop off the patients, or they're just traumas or just transfers from other facilities that just need higher care. I came to Valley Children's, I would check them in, band-aid, what's it called? Let me put a little band them. I would band them and put them in the tracker. So it's like a little system where it shows all on the EMR, which is an electric medical records, which is a way of kind of just organizing all the notes and the patients and wherever you're at. And then so I would put the patients on there. And of course, without me putting the patients on there, nobody can do anything, right? Because you can't order anything, you can't really do anything with the patient. So it's really important for me to put those patients, especially for traumas, because as soon as they get here, you go to the trauma room, trauma team jumps in, they need to do their orders, do everything they need to do to stabilize the patient. And, I need to have them in the system in order for them to do all that. So, my job was a little more important than I thought. But me being pre-med and just wanting to learn a lot, of course, I got to learn a lot of things that Mirka would talk about, right? So you get to pick up some things, even though you're not necessarily just verifying information, verifying demographic information as insurances. You're gonna get to learn like little things, not in detail how Mirka explained, but you do get to see the flow of the emergency department. You get to see the role of everyone, right? With the RTs, the techs, what else? Registration, physicians, PAs, NPs, RNs, pharmacists, the trauma surgeon, all that stuff. So you learn more than you think. And little things that, of course, Mirka mentioned, I don't want to repeat it, but you do get to learn things that she's done just through observing and also assisting. I got lucky that I'm really friendly and talk a lot, so I got to meet a lot of the nurses there and physicians. So they would kind of let me in and kind of talk about the cases, at least for the physicians. And for nurses, I would get to assist and do some things when I wasn't doing anything. Or even if I was, I would just jump in, because, why not? So you do get to learn a lot. And like I said, some people consider it clinical experience, because I do have contact with the patient. So there's that. So I'll just jump into, so for those who can't land a position or have like a, EMT Cna certification, and so happens to know somebody and can do registration, the ED somewhere, it is still a nice experience. So I'll jump into the Director of Outreach role. Mostly I'm gonna talk about things I learned as a volunteer. This Director of Outreach role is more like a leadership position, which is nice. But I started off as a volunteer with the UCSF Mobile Heal Clinic when it started. I want to say like the end of 2018, in December, I want to say. And we had, maybe like 3 days a month that we had volunteering opportunities. So it wasn't much. It grew, after a while. And everything is volunteering. I didn't get paid for anything. So then once I became the Director of Outreach role, which is just like any other place, you just apply. The previous person that's a director, it chooses whoever they want to appoint to take over their position. I ended up getting it along with Mirka. And we just pretty much carried on recruiting and training volunteers. And then as a volunteer, I learned how to triage patients, take vitals, and have the opportunity to observe physicians when assessing patients. So you get to do like your little shadowing on top of, being hands-on and taking vitals and talking to the patient. It's pretty nice. You don't get to do that in a lot of places. What else? And then later on, you get to learn like little more detailed things of like HIV testing. We got lucky and the med students would teach us how to do the flu shots, kind of like a 20-second, like bam, 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 is how you do it. And we just learned urine analysis and blood glucose. And these are the things that I would teach the volunteers if they weren't too familiar with that, which most of them weren't. And even the medical students for UCSF Prime. So that was kind of nice to be able to kind of teach them these things. And then just carried on participating in planning process of free clinics, recruiting finances, and more kind of focused more on just training and recruiting volunteers. But when we could, we would help the other coordinator with what they needed. Okay, and then just little pictures there on the right. Mitka's in there too. Okay, you can go on to the next. Cool. So then this is all pre-COVID. So then once COVID hit, we're in the pandemic, not too long after, the UCSF Mobile Heal Clinic became CEP, so which is a COVID-19 equity project, and pretty much just dropped what we did before, and now we just focused on COVID-19 and providing tests. Once vaccinations came out, vaccinating, and just adjusting to the changes. And so far, I've been there for 6 months. I started in June. Actually employed instead of doing volunteer work. And requirements for the position. So like Mitka says, it's like who you know, kind of helps out a lot, since I've been there since the beginning with the Mobile Heal Clinic, and being familiar with some of the staff and knowing Dr. Bond, who's mainly in charge of things. It really helped me to get in. But I also did have an Emt Course certification that I completed, which I'll talk about at the end, or I can talk about it now. So I took the Emt course at Valley ROP, which is, I think they have like an adult school in Sanger, Selma, I want to say Reedley. You guys can check the website. So just type in Valley ROP Emt course, and it's only $350 compared to like thousands of dollars in other places. And it's the same education. So I'd really highly recommend doing that. A lot of people at work that I work with are doing that as well. Mostly pre-meds. So you guys look at it. Maybe you're still in time to sign up for the summer courses. Mine, I think it was 4 weeks around there. So it was accelerated, so you just get it done. But it was like 3 to 4 days a week, like 8 hours. Honestly, maybe 4 or 5 days a week, 8 hours a day. And yeah, you get it done in 4 weeks, but there's 6 weeks, 8 weeks, maybe 12 weeks. You would have to look into it. I don't know exactly the duration of the program, but they have different ones. And they're all the same amount, $350. So just, X amount of hours you need to complete. And then the 2 ride-alongs that you need to do with 24 hours in total to complete the course. Good experience. And I think they also help you if you really want to become an EMT. To once you get your license, when you take the national, what's it called? The national registry test, they'll help you land a job in American Ambulance, which is one of the big ones here in the Central Valley. So yeah, so those interested, check that out. If not, like Mitka said, you can take them at whatever school you're at. Usually they offer it as a course, but I mean, you have to take it the whole semester. This is over summer, get it done. And then that'll really help you to get into any of these positions. All right, so circling back to responsibilities. So I'll just go mention all of it and then go into detail to some of it. Mostly MAB, because that's kind of the part I like more. So what do we do here? So accurately register patients, which I did a lot at Valley Children's, so I was good at that. It's much easier here because they don't ask for insurance. And then we also administer COVID-19 and flu shots, influenza vaccines. We prepare the vaccines, administer the COVID-19 PCR tests. And we did rapid tests, but as a whole, the county, I think we're running low, so we stopped doing rapid tests. They're not as accurate as the PCR. We administer monoclonal antibody therapy, which is MAB. We prepare the MAB medication, do health screenings for MAB. We take vitals like blood pressure, heart rate, respiratory rate, the pulse ox, the saturation percentage of O2 in your peripheral capillaries, right? And your temperature. And then we also chart, which is pretty nice. So I don't think any other place you would, well, maybe there is, but that you would chart and put in orders, kind of like how nurses do. So we get to do all that using Epic, which is one of the EMRs that's mainly used, I think, here in the Central Valley as well. So that's pretty nice. So the charting and then the orders, again, that's something that only saw nurses do and physicians at a hospital. So the fact that we can do that, we have a template, we have to type everything out instead of using a drag-in like physicians and PAs and MPs, but it doesn't take too long because you could just save the template and just add in or changes per patient. That's pretty cool that you get to do that. And then we learn about rapid response when we do observation. So, what do we do in a situation where somebody has, response to the vaccine and they have, some facial swelling, or they break onto hives, shortness of breath, things like that. So we learn what to do in those situations. And we learn what to look for. A lot of people, I personally haven't seen anything happen, maybe a few times. They thought they had some rapid response, but it was just them being kind of very nervous, like an anxiety attack. And we know what to look for when we have that, just a higher blood pressure, pulse ox is good, higher heart rate, and you talk to them, of course, you can tell they're just a little nervous. But if it was like the opposite, then that's not good. So we call the NP and all that, 911. That goes for observation. Then staying up to date with COVID-19 changes. A lot of things changing over time, especially with who can get what. It's just right now like this mix matching of the boosters. So we have to keep updated with all these changes because all the patients have a lot of questions all the time, and of course we don't know how to answer it. You can always get the NP, or the physician to come and better answer that question. And then things I've gone. So, like I said, how Mirka said, knowing it's who kind of helps a lot. Like I said, I didn't have any. I wasn't an LVN, CNA. I took the Emt course, but I wasn't like licensed, right? Because I never took the national registry. The test, also in phlebotomy, and yet I get to do all this stuff that I've mentioned. You get your medical assistant certification as you're working to allow you to do all these things, and then your BLS. So that's kind of nice. But if you do have a LVN, if you're a certified LVN, then your pay is higher and you can do more things and be more of like a lead. But more or less, you still get to do all the things I've mentioned. What else? And it's just nice just working with the project. Now that we have more staff, you can reach out to the communities, right? Because the point of this project is to kind of reach out to these underserved communities that were disproportional. It's unfortunately affected by the pandemic. And kind of just going. Luckily, we have the funds to have RVs and vans and all the equipment to go out to these places and provide all these services to them. Is pretty nice, and just getting learning more about these communities. It was kind of cool too. Is that if you want to work with a specific community, you can let those that do your schedule. So and you can work with homeless populations. You can do events with them. Or bike and farm workers, Latino community, Hmong community, Punjabi, just specific with kids. So you would be assigned those events. You can go out and interact with them. And what else? And there's other little things that you get to do in this position that not so hands-on clinical. I would just kind of end it with the flow of what we do, so you kind of have an idea. So there's from start to end, you enter in the entrance, there's traffic control. Sometimes we're putting traffic control. You still need to know of course, like what you're doing with COVID-19 and the vaccines and all that stuff. So you kind of just check in with them. Okay, what are you here for? Testing or vaccines or vaccination? Like, okay, so which one? You have to look at their card and make sure that if they're getting their booster, they're that 6 months period from the second dose. So now exceptions can be made, but for the most part, we don't. And then, you know, educate them in the fact that they can take any of the three, you know, Johnson & Johnson, Pfizer, Moderna. They can mix match. There's no problem with that. And then also you get those from that are traveling or from, you know, they got their vaccination in another country. And there's some that don't, if they're not Johnson & Johnson, Moderna, or Pfizer, they don't count here. So you'd have to restart and start from the first dose, carry on to the second, so forth. So you have to explain that to them as well. So you need to know all that stuff, and then, you know, you get them going to whatever lane they want to go to. So then there's, you know, the testing and vaccination, and you might be assigned testing, so you just focus on testing. It's pretty easy. A lot of it's self-administered. They do it themselves unless they feel uncomfortable doing it. So then you can do it for them. And it's very easy, you know, technique that you use. Sometimes again, the nasal cavity doesn't touch their brain, you know. And then for kids are a little harder. But yeah, for the most part, the children is where it's a little tricky, right? Because their nasal cavity and the distal nasal cavity and the outer nostril is kind of short, so you can't go too far up, and they move around a lot. So got to be careful with that. And then babies as well. And then going to vaccination, you know, just having good technique and vaccinating. And now that we're doing peds, it's a little harder too with the kids moving around. I guess I'm good with kids, so they call me sometimes. I had one kid going crazy. Yeah, it was kind of hard. They kept moving around. Dad wasn't even strong enough to hold her down, so they get more people to hold her down. Yeah, but it was as long as you're really fast, you know what you're doing, you're good, and have the patience too. So you have to know all that, and then you always double check. So important when you do registration and vaccinating. You got to make sure you're giving the right dosage to the right person, and then what they wanted. You know, sometimes mistakes are made, but you try not to make those mistakes. And you know, especially with Moderna, at the boosters, 0.25 milliliters, I want to say, and then the regular dosage is 0.5, and 0.5 is considered the third or additional dose, which usually those are immunocompromised get, because they need more protection than, you know, your average person is not immunocompromised. So they want to make sure they give them the right one, or you don't give that one to me, you know, and I'm like super sick after that. I'll be fine, but it just sucks. What else? And then once you're done with that, you go to observation, and that's when you just, you know, you have to learn the rapid response. And what to do in those situations, what to look for. And then after, you're on your way. And for MAB, it's a whole process like of that as well. And it's pretty cool that you get to administer a sub-Q medication. They were doing, what's it called? Regeneron or Regen-Co, which is pretty much two medications. One is, I don't even know how to pronounce it. Let me look it up because I have it here. Casirivimab and Endevimab. So you do both. And then depending on whether you have two people come together, you know, at least two people are coming, you can do co-formulated and then non-co-formulated. One of them being like both of them are together, and then the other one being they're separate, but each vial has enough for two patients. And then you're supposed to administer 4 shots with 2.5 milliliters in each, because since it's so much, it's split into 4. And then you do 2 CAS and the other 2 Endev, and you do them at the, try to find the fat, right? It's a sub-Q injection. So you do the back of the arms and then the lower abdomen area. And you get to learn how to do that properly. You gear up, of course, you don't want to get infected. And that's when you do this kind of the scribing, I guess you can say, the charting, and then taking the vitals and notes so you can input that on their account. And then at the end, you guys keep taking vitals, and then before they leave the MP, or you know, the healthcare provider comes and, you know, checks it out and sees everything's okay, so they can leave after an hour of observation. we do most of it. And Pete just comes and checks everything, make sure everything's okay. And yeah, I think that's it. Thank you for listening.
Great. Thanks so much, Noel, for telling us all about your experiences you've had. I think a lot of people have noticed it's kind of been hard to get experience during COVID, but this is an example too about how there's some new opportunities coming up because of COVID. We had a question in the chat asking you about your volunteering opportunity. I think it was with the Mobile Heal Clinic, about how you found that opportunity, or how do you recommend finding them?
I actually found it through Mi Mentor. Let me see. Let me remember. I think I was like at a get together with the Mi Mentor, like our board, right, general board or something, and a med student was there, and she mentioned it, like, "Hey, have you heard of da, da, da?" And I'm like, "No." Like, do you want to volunteer? Like, yeah, of course. And not too many volunteers were going, or people were going, because a lot of them were local here in Fresno and would go out to like Atwater and Merced, areas like that, which is kind of like far, and waking up in the morning and driving an hour and a half, 2 hours. A lot of people are not down with that, I guess. But I mean, I wanted to do it, wanted to learn it, and the effort to try to make it to all these events when it first started. And I really loved it, because I got to learn so many things, like what place will allow you to do vitals and do flu shots, and it's just like as a volunteer. So yeah, to answer your question, through Mi Mentor and just knowing somebody, and it was just the beginning, like a startup of this mobile clinic. And then from there, it became this, honestly. It's gone a long ways, from trying to find somebody to help us get an art. We had at the time, I guess there wasn't so much funding. So at least Dr. Baum was able to provide the volunteers and the medical students, residents, and medical staff, and some of the equipment and resources, but we still needed somebody else to provide like an RV and other staff, like licensed staff. And so then, we're very dependent on other people. And then now that we have more, Dr. Bond has more funding, we do everything ourselves now.
Can I point out that sorry, I'm like right next to each other. Okay, so I want to point out that really like do the best you can to really network, get to know people, get to know other pre-meds or like pre-health students, because many times they do know a lot of like things that you may not be aware of that's going on. And then it's really important to put in the time into these experiences. Like me and Noel, like we will drive like 1-2 hours all the way just to go volunteer for a few hours, then come back to Fresno. And then the thing with that is that the physician we volunteer, he really saw the effort that we put in. So that's how we were able to get the leadership positions with the clinic, kind of move on with the clinic. So you really want to put time into these experiences and just put yourself out there. I know it can be time consuming, but many times being able to move up and like just get overall like these patient interaction experiences is really worth it. So you really got to put yourself out there. And constantly, like if you check Me Mentor, people are always posting experiences and like different jobs and things that you can do. So keep an eye out.
Yeah, I agree. Like I said, this is a time where America and I were at Valley Children's. We worked overnight. So sometimes we didn't even sleep. We'll just get out of work, get ready, drive 2 hours to go volunteer for 4 hours, head back on 2-hour drive, and then eat, do whatever, and then go to sleep again to work the next night. It's tough, tough being a pre-med out here, but that's what you got to do.
We have a question about some of the requirements for the vaccine support specialist position. So they're asking if training on site can be provided, or if the other healthcare experience is like required, like from the other positions that you mentioned.
I think we might be hiring. I don't know that we're hiring, maybe, but for the requirements, they're requiring a little bit more, they're kind of more strict now than they were before. Now that we're getting more funding, and I think we might end up becoming like an actual clinic. So in the future, apply. But definitely having any like CNA, LVN, EMT, phlebotomy will help a lot. It's not necessary, but it's highly recommended. Like I said, I was with the clinic. I knew Dr. Bond for a while and other staff. I took the Emt course. Before that, I worked at Valley Children's. I knew the hospital setting. I shadowed in the OR and the ED as well multiple times. So I had, some, experience, I guess. But I highly recommend to have one of the ones I've mentioned. The EMT would probably be the easiest one to do that and take the test. You get a bump in pay if you have your license, and it will really help. It'll really help. So definitely the EMT for sure. If you can do any of those. If you haven't done any and you have time to go over summer, do your EMT, take the license, National Registry test to get your license, and you should be good to go. Did that answer the question?
Yeah, we have a follow-up question. I think Mirka did touch up a little bit on this before, but they're asking, what qualifications did you have to get into EMT training? What were the requirements?
Oh, before I answer that question, I think they asked about like while you're working, you get trained. You do get trained for all these things while working. You get to observe. So when you first start, you pretty much observe like honestly, like the first 2-3 days. You get to observe everyone, whether you do testing, vaccination, MAB, and you observe what they do, and then you kind of just thrown in, and they help you while you're doing it. They teach you how to. Before you start vaccinating on people, you pretty much practice before with like an apple or something, and then each other, and then you have to get like see your technique, and then after you do 10, I think they do 10 per person. Or per 10 with somebody observing you to make sure you're doing it right. So you learn everything as you work, right? So it's not like I knew how to do all of this beforehand. And then now, so second question was for the EMT. I don't think you need anything. I just remember just signing up. As long as you have $350 and the time, that's it.
I think that's the questions I had on my end. And Ailey, if you have any more for Noel, you can go ahead.
Okay, yeah, I just had that one. So I think we can move on to medium.
Our next Miriam.
Go ahead.
Yeah, and she will be presenting about her ophthalmic tech and clinical research assistant position.
So hi, my name is Miriam Perales. So just a little bit about myself. So I'm from McFarland, California, closer to Bakersfield, Kern County area. And most of y'all are up north when it comes to the Central Valley and more south. I graduated from UC Berkeley in 2017 with an American Studies major in U.S. healthcare. I came into Berkeley as pre-med, but life happens and academics don't go as well as you needed to be. So I took a step back from that. And even then, I took some time off. I didn't go straight into a postbac right after my undergrad. I took time off to really reflect and realize if I wanted to actually go into medicine, like MD, DO medicine, not just like PA, nursing, because I had a lot of people throw other ideas out at me. And that's what I'll talk about more about my ophthalmic experience. But for the past 2 years, I was doing a formal postbac at Washington University in St. Louis. I was living in Missouri, and I just completed that this past summer, so in May 2021. And now I'm back here at home in McFarland with my parents, working as a clinical research assistant, which I'll also touch more about that. If anyone's interested, I have a pre-med that's Instagram that just talks about my journey, because I know there's not a lot of us, like there are non-traditional pre-med journey. And even then, I feel like that's becoming the new normal into being pre-med, is being this non-traditional, just taking the path of like really reflecting on what steps to take to be pre-med and not rushing the process of it all. So as I was saying, I've worked 2 jobs in ophthalmology. So when it comes to ophthalmology, just a little basic guidelines, because I didn't know this when I entered too. So there's a difference between an optometrist and an ophthalmologist. So the optometrist just gives you the prescription to your glasses, which some of us who can't see that well tend to see optometrists most of the time. We don't see ophthalmologists, but ophthalmologists is usually when you get your eyes dilated to check the health of your eye. They're the ones to like prescribe eye drops for usually patients that are older, the ones that get glaucoma or even like having cataract surgery. So ophthalmologists go to medical school to get their degree and specialize in ophthalmology, which they're the surgeons and they're the ones that take the health of your eye. Just to give you guys an example, like diabetes, it could also affect the eyes. So for that, you go to a doctor to check your eyes because you can get diabetes in the eyes and they're the ones that are treating you and making sure your care is right. So unlike the other positions that everyone talked about, being an ophthalmic technician, you do not need any experience or background. Just having the wanting to learn is what gets you put. It's on the job training. Because in way to be a certified ophthalmic technician, you need an ophthalmic doctor to sponsor you. So a lot of these jobs are on hand. See anything that's like having to deal with vision or even having just to deal with eyes, you can get that job and get that patient interaction experience and with the doctors. And it's what I did. So I also want to piggyback on what Mirka was telling you. Networking is very important because that's how I got this job as an ophthalmic technician. Coming out after Berkeley, I didn't know what I wanted to do. I just knew if I came home, my options were very limited. And I was part of an organization called the Biology Scholars Program at UC Berkeley. And they're like, hey, eye physicians of the East Bay is looking for ophthalmic technicians. Anyone that's interested is on the job training. We're hiring. And they're always constantly hiring because they hire students that are pre-med, pre-health, and they stay there for a year or two and then go on to their next steps. And these doctors love mentoring, love showing you what's going on. So it's a very nice 8 to 5 job. You scribe, there's a lot of patient interaction. You learn a lot on the job. And personally, it changed me because I never thought I would want to go into ophthalmology as a specialty until I was introduced to this job. And currently now, I combined my clinical research experience I got during my postbac, and I already had that ophthalmic experience before my postbac with in Bakersfield. Now I work as a clinical research assistant with California Retina Consultants. It's experimental research. So we look at different eye diseases and they either get a sham or an injection, which is unknown to the patient. On our end as the clinical research assistants and the coordinators, we know what they're getting for medications, but just to see the progression, if that medication helps with their eye diseases. And that's where I'm currently at. Can you go to the next slide? Thank you. So a little bit about eye physicians of the East Bay. It's in Oakland, California. So anyone that's in the Bay Area, look out for it. They're always hiring, get in contact with me. So it's a private practice. So we saw over 100 patients a day. Your skills as an ophthalmic physician goes into working up the patients, such as taking their history of present illness, imaging, such as OCT, cataract surgery. We have a glaucoma specialist, so also getting patients ready for glaucoma surgery. You take them step by step of what's going on. You learn a lot about the eye, so you get very comfortable in explaining eye diseases to patients and even making sure you don't get stuck in medical jargon or science jargon to know how to tell terminology to patients of what's going on with their eyes. Because even then, simple thing as cataract surgery, which is the most common surgery in the United States, patients think you pop their eye out of their eye socket and you have to explain to them that's not what happens. It's a little small incision, it's 15 minutes the most when it comes to surgery and just an implant put in their eye. But that's a lot of challenges for oneself when you're still learning how to talk to patients and even interacting with the doctors. It's what helped me grow to being able to explain their diagnosis and their next steps. We also scribed, and you also have a scribe position and doing prior authorization to making sure they get their medications covered by the insurances, triaging over the phone, and just patient flow overall. For myself, when I came in, just wanted that patient interaction, learning about the doctors. As you see at the bottom quarter here, those are the 3 doctors we have. It's Stephen Pascal, Jane Lohman, and Michael Wong. They're very nice. They love mentoring students, just whatever you want to do in the future. And the picture of surgery, the one looking through the microscope, is actually myself. They do medical mission trips every year, and they take you, if you are up to your skills in ophthalmics, if they see you're one of those that are up to your skills in your ophthalmic experience, they take you. And I think that's what changed my mind of me wanting to go back to medicine. And just seeing cataract surgery in person and being able to interact in Guatemala was very nice because I like to use more my Spanish than English. So it was nice to be an interpreter and just not getting questioned on an every single day basis. If I was smart enough, I got in that a lot of my office because I was the one only few Latinas in our entire technician. So I always have patients going, "Oh, are you the smart one?" It's very, you tend to internalize it a bit, and you don't know if you're like quote unquote smart, but you're mentoring with physicians is what helped me. Like those 3 doctors helped me so much to realize my potential in myself of me wanting to go back into medicine, which is why I did a postgrad. So I highly recommend anybody that like wants to do some clinical research. I know you never think about, you don't want to like specifically think about like eyeballs, and maybe you want more experience that's very general, but this gives you a lot of skills that you will need as a medical student or even as a doctor, even if it's just eyes. So now in my current role, I'm a clinical research assistant at California Retina Consultants. So I assist in patient visits, doing follow-up calls, setting up appointments, a lot of regulatory stuff. So speaking to monitors and sponsors about what's going on in our clinic. Again, this is very experimental research. So it comes with injections, setting up injections, making sure we are still well with clinical flow because they have their own clinic downstairs and we're upstairs is the research department. But our patients go through their own flow, then we bring them to clinic to be seen by the physician. We're in a very big transition. So our department, California Retina Consultants, joined a larger group called Retina Consultants of America, which is mainly run by the Retina Consultants of Texas, which where I was this past week, learning training and seeing how we're going to implement what they have going on in their office here. So it's very good networking skills. I currently really love my job of the direction we're heading because I can say how I want to grow as a person and where I'm coming from in my background. Again, you don't need ophthalmic experience for this or even clinical research. We have a lot of very new people on our team and we're currently just looking to hire anyone that's willing to learn and wants to expand their knowledge and just like knowing what research is about, wanting to really be part of a team, and just getting that patient exposure, knowing what clinical flow is, knowing what clinical research does, because it's very different just from doing bench work research in a lab. We're more than happy to have any people join our team. So again, if you're interested, reach out to me. I know like opportunities like this are very rare in the Central Valley, specifically in Kern County, which is why I haven't been in Kern County for a very long time, because I was looking for that opportunity that could bring me home just for a bit while I'm currently applying to like hoping to apply to med school this upcoming cycle. So it's a really good balance to have a team that supports you and your manager that supports you over your overall like long-term goals and just letting you grow in a company.
Thank you for sharing that, Miriam. We have a question for you. So they're asking, did you take or do you recommend a medical terminology course before starting to scribe?
So I'm gonna be very transparent. So again, I had no background. I didn't know anything about the eyeball. They literally taught me that on the job and they just threw me into scribing. It was the hardest thing for me to ever do even then. But I had a lot of support from my doctors. I would go home and I would actually study. So yeah, I don't know if doing a medical terminology course would help you because this is just ophthalmic experience, not general ophthalmology. I do highly recommend it if you're going to be scribing for like an emergency room or any other general practices like that, because you're looking at the whole human body. But for ophthalmology, it's very eye specific. Now when it comes to scribing, a lot of systems is just clicking a button, like the doctor says something, you just click what they tell you. When I started, we literally had to type things in and I would go back and fix the chart. And I was thankful that my doctors allowed me to do that when I was a scribe. And at the end, I just ended up clicking buttons when we transitioned to Epic, because we used to be on NextGen, and NextGen was us actually scribing in the terminologies of it. And now it's just a lot of like clicking dots. So just know, like, yes, when you enter the world of ophthalmology, it's just eyeball focused. There is some overall health stuff when it comes to like either diabetes and your glaucoma, your cataracts, but all that just really deals with the eyes.
Thank you for your response. Sohan, hand raised, so go ahead, Sohan.
Yeah, thanks, Miriam. So I have a question. As someone with no experience, what were those first few days like? Like, did you get any independence? At one point, were you on your own?
Yeah, so my first few times when I started in ophthalmology was a lot of shadowing. They have you with a technician that's been there for more years. It is more at their top of their game. So you shadow them through their patient flow. You shadow them like how to do a phone call. You shadow them how to do a prior authorization. I think it took me like a month. They had me like a month in training like that, and then they slowly let you do certain tasks on your own, but you were shadowed. So just know that you're not just put in there like, okay, we expect you to do this on your own. They shadowed you to make sure you were comfortable enough to do it. What took me the longest is scribing, because I'm just a slow typer and I didn't know the terminology. And I just felt like I was letting down the doctors, because again, we saw over 100 patients a day. Making sure that doctors keep moving through each patient. And if you feel like you're slowing them down, I took that on to myself. It's okay. It's going to be okay is what my mentor, that was a Scribe, the technician that was older than me, that was helping me out to train me on, helped me out a lot in. And at the end, I feel like between your training, it just clicks. And I don't know how to explain it, but it literally just clicked to the point that when a patient came in, and if I took their history of present illness and they told me a little bit more about their background, and if I looked at their chart, I knew how to diagnose them and what their next steps was. And I got very comfortable with the doctors to be like, hey, I'm just trying to see if like I'm in the right scope of things. Is this what you're gonna end up doing? And they're like, oh, let's see. And then I'll come in and scribe for them. And before I knew it, I knew what glaucoma drops each patient should be when they come in the first time getting diagnosed for glaucoma. I knew what a cataract looked like when people were talking about the symptoms, that there was probably time to have cataract surgery. Even when it came to pink eye, one of the eye doctors was like, why do you need me for? He's like, you already know what to prescribe. Why do you need me? I was like, I don't have the MD. You're the one that has to do it either way. But that's what I say. It was a nice atmosphere with doctors that you grow, and even like voice your opinion on what you think it is, to see what your level of knowledge is.
Thank you for answering that. There's another question here. So are there any requirements, or is experience required for the opportunity in Bakersfield?
Any requirements right now? At this point, we hope you have a bachelor's and you're done with your bachelor's degree. Having a science background would be nice, just so you're not overwhelmed for certain types of terminology. I will be very transparent. I'm the only one that's ophthalmic besides another lady, but she's been working there for years. But from our newly fresh team, I'm the only one that came in with ophthalmic experience. So I always explain things, and I'm just a nerd when it comes to ophthalmology. So I'm always talking to my coworkers about ophthalmology stuff where they need help. We're putting some training into place, but because of this transition, there's a lot of cleanup work that we're doing regulatory. Besides that, we'll just look at your resume, and if you're fit for our team is at this point. If you're ready to work for that, we work 8 hours a day, Monday through Friday. If you come in on the weekends, cool. If you don't, that's fine. But we're really looking for team members that are ready to like pick up and get the grind moving, because we're moving in very different directions and very different roles for each of us. And we're expanding our team to expand what Texas has, because Texas has like a specific flow of their patients. But we're hoping that you don't get the experience that we did, because when I entered, they didn't tell me I was going to do cleanup work from coordinators who didn't really do their job in the background. So we're at a position that we now cleaned up as much as we could, and we're just trying to build a strong team now that actually cares about research and actually takes the time to talk to patients, let them know what's going on, and wants to talk to the doctors and wants to grow in the company. So we're just looking for really highly motivated people. Whoever it is that asked that question, private message me and get in contact with me. I could tell you more.
Thank you, Miriam. So if any of you guys are interested in that, definitely reach out to Miriam. She'd be happy to talk to you guys about that. So we had a couple of questions, Miriam, regarding your post-bac. So someone was asking in the chat kind of why you decided to pursue a post-bac and how you went about financing it, or how anybody could do it in general.
So for myself, the first question I asked myself was, how much time away did I need from school? So I was burnt out after UC Berkeley, and I at least wanted to give myself 2 years before even deciding if I wanted to return back to school. I didn't So then what I did from there was, do I want to do on my own postbac and do it through community college, or do I want to do a formal postbac? And from there, I always knew I was going to go back to school after those 2 years mark. So when I started working, I started saving. I didn't know what I was going to save, what I was saving that money for. I knew I just wanted to do school, but I just kept saving on the side for just in case if I changed my mind. It's literally what happened. I changed my mind right after Guatemala and realized medicine was actually for me. And the next step I did was reach out to people who did postbacs. Like Mi Mentor has thousands of events all the time when it comes to, hey, look at these people that did a postbac. And Mi Mentor has a lot of people who did postbacs on their own and even formal postbacs. And that was my next question, was that, do I want to do a formal postbac? And I know it's going to cost money. And for myself, it was a yes. Like, I was not very confident in the sciences when I came out of Berkeley. My GPA was very, very, very low. Like my science GPA is super low before I did my postbac. And I knew I needed that hand holding and that support. And I also knew that I needed letters of recommendation from professors because I wasn't that close to any science professors at Berkeley. Classes were very large and I was very anxiety inducing to even build that relationship when I felt like I wasn't even confident in the sciences. The reason why I chose to move across the country was because it was the most affordable postbac for myself. That one, I got in, and also the most affordable. California has very limited postbacs, and a lot of them are not career changer postbacs. Like, yes, I did some sciences at Berkeley, but I didn't do all my sciences. I only took like 2 or 3 science courses. So it gave me the opportunity to be a career changer for that. So I started from 0. So it took 2 years to do it. And a lot of Californias are like a 1-year program of just boosting up your GPA. I needed a whole revamping of my GPA. So I moved out there because Missouri is very affordable to live in. And I knew I didn't want to work full time, which is what I was also doing in undergrad. I was working full time and maintaining myself during my undergrad. And this time I was like, nope, this time is for myself. It's for myself to see if I could actually do this. And it was nice to have a cohort of people, like-minded people, same thing. People were older than me. I started my postbac at, 24, met 30-year-olds trying to go into med school and starting also their career changers, met people from different backgrounds, people that had careers going. They were teachers, had like a wife and kids, and he decided he wanted to go back to school and do medicine, left teaching, now he's in med school. And it's nice to be surrounded with people like that, letting you know that it's never too late if you really want to enter medicine. Like if you're really, really for it, like nothing's gonna really stop you. You're just gonna take your time. There's no race here. Like you literally are not sprinting to get anywhere. Your life, and you get to control it. And I came out of that postbac with all A's, all B's, and I got my confidence back in sciences. Realized I could actually do this. Came out with a committee letter and having really strong letters of recommendations and hoping that everything goes well. Overall.
Thank you for sharing, Miriam. You also mentioned earlier that you have like a Instagram page for pre-meds if you wanted to drop your handle in the chat so that pre-meds here can kind of follow you on your journey.
Yeah, and you could also DM me there. Like, it's fine. That's why I have that one there to answer any questions when it comes to postbacs, choosing clinical experience, careers, and just talking about it, because I know when I was an undergrad, I kept thinking like I was going to do my postbac right after undergrad, and I had to be very real with myself that that wasn't a possibility, and that's okay. And I still come across undergrads the exact same way, very gung-ho, very like, I'm going to do this. This is what I'm going to do right after undergrad. And I make them sit down and talk about like, wait, I shouldn't do that. So I could give you guys a little perspective on that. And I know we all just really want to be doctors for our own passions and reasons, but it's okay to take time.
Okay, so Miriam was our last speaker. So if you guys have any questions at this point for any of the panelists that presented prior to Miriam, or even for Miriam as well, feel free to unmute yourselves or put them in the chat. We want to open it up to all of our attendees to get their questions answered.
And the presentation, the slides from the presentation will be shared out to you guys. Normally we have a survey link, but right now, since it's finals time and holidays time, we weren't able to get it out on time. But in the next few days, do expect an email from us that'll have the link to the survey. And then if you're able to fill out that survey, just kind of telling us how we did, what you guys want next time for when we do this presentation, and what other presentations we should do. Once you complete that, we'll be able to send you guys the slides from today's presentation.
So yeah, just
So,
try out for that post-event survey. When it comes in, fill it out, give us your feedback. And once you filled it out, within like maybe a week or so, you'll be getting all the slides along with all of the speakers' emails to contact them for further questions.
okay, perfect. So if anybody had any other questions that you guys wanted to ask any of our speakers, you guys can go ahead and unmute yourself and just feel free to ask anything that you guys had questions about.